Hey everyone, and welcome to this explainer. Today, we're doing a complete reframe on how we think about human movement, communication, and the truly life-changing careers that support them. We're going to look at how bodies and brains navigate the world differently, and more importantly, how we can use that understanding to empower ourselves and the people around us.
Now, before we really get going, just a quick heads up. The material we're covering today is for general education. It is not medical advice, so please always consult a qualified healthcare professional for individualized care and your specific needs.
All right, let's dive in with a fundamental truth that's going to guide absolutely everything we discuss today. Moving and communicating differently does not mean less. Difference is not deficit. This idea, presuming competence and honoring every single individual's dignity, is really the cornerstone of modern rehabilitation and allied health.
So here's our roadmap for today. We've got communication beyond speech, movement and daily living, tools of freedom, the Move, Do, Communicate framework, and finally, accessible career pathways. Let's jump right into Section 1, Communication Beyond Speech. Because, as we'll see, speech is way more than just talking.
You know, communication is so much broader than just spoken words. And the moment we realize that, we open up a whole new world of understanding. Take aphasia, for example. The crucial thing to understand here is that aphasia affects language access, not intelligence. It often happens after a brain injury, like a stroke. But their person's memories, their personality, their sharp intellect, all of that is fully intact. They're just hitting a roadblock and accessing the language center of their brain. So you should always talk to someone with aphasia like the capable adult they are, because that's exactly who is sitting right in front of you.
And it's fascinating because aphasia can present so differently in different people. It actually separates the ability to output language from the ability to understand it. So with expressive aphasia, the person knows exactly what they want to tell you, but they just can't get the words out. It's on the tip of their tongue. But with receptive aphasia, their speech might sound perfectly fluid, but the words themselves might not make much sense in context, and they really struggle to comprehend what you're saying to them. Both of these situations require immense patience and respect from us as communication partners.
Now, when speech just isn't a reliable path, that's where AAC steps in. AAC stands for Augmentative and Alternative Communication. And it covers the whole shebang, everything from simple gestures and picture boards to high-tech customized tablets. AAC proves once and for all that a non-speaking person has a fully active, engaged mind. We can never make the mistake of thinking that just because someone doesn't speak with their vocal cords, they don't have anything to say.
But let's put this into perspective with this tiny number, 0.05%. While a ton of people use low-tech AAC, things like pointing, nodding, or picture exchange boards, only an estimated 0.05% of children and youth actually rely on advanced high-tech speech-generating devices. We're talking about devices that use predictive text, eye tracking, or subtle switches to synthesize speech. It's literally the exact same kind of life-changing technology that the brilliant physicist Stephen Hawking used to lecture the world.
Moving right along to Section 2, Movement and Daily Living, where we are validating the invisible and dynamic.
Just like with communication, human movement is incredibly diverse, right? And not all disabilities are immediately obvious to the naked eye. We have to explicitly recognize that many disabilities are completely invisible, or they fluctuate from day to day. We call these dynamic disabilities. Say someone has multiple sclerosis, or chronic fatigue syndrome, or Ehlers-Danlos. That means they might be able to walk totally unassisted on a Tuesday, but absolutely require a wheelchair by Thursday just to conserve energy and manage their pain. Ambulatory wheelchair users, meaning people who can walk some of the time but use a chair when they need to, are entirely valid. They are not faking it when they stand up to reach a shelf. We just need to believe people.
And this is absolutely crucial. When differences in gait or balance or movement start impacting activities of daily living, or ADLs as they're known in the field, it directly affects a person's dignity and independence. Imagine the frustration of knowing exactly how to dress yourself, but your fingers just won't cooperate with the buttons. Or wanting to take a shower but feeling terrified that you might fall. These aren't just chores. These are the fundamental building blocks of an autonomous life. Which brings us to Section 3, Tools of Freedom. This is all about empowering autonomy and independence. So when those daily activities become difficult, people don't just give up, we adapt. Have you ever noticed someone doing this next thing in a room? You might not have even realized there's a specific clinical term for it. Have you ever watched someone kind of trace the perimeter of a room, keeping one hand on a couch, then transferring to a table, and then leaning on the wall?
That's called furniture surfing. It's a highly natural way people compensate for things like dizziness, joint instability, or muscle weakness. But while it's a clever workaround, it's also a glaring sign that the person is experiencing serious friction in their environment. It's a sign that the right mobility support could help them move so much more safely and confidently right through the center of the room.
Enter the therapy toolkit. From a simple single-point cane to a motorized power scooter or even super clever low-tech adaptive equipment, like a button hook to help with dressing or a grab bar in the shower. These devices are practical, tangible solutions to that daily friction. They literally take the danger and the exhaustion right out of the equation.
I absolutely love this perspective, and it perfectly captures the mindset shift we all need to make. We've got to completely shatter the stigma around these devices. Using a wheelchair or a rollator or a cane isn't giving up. No way! It is unlocking your world. It's conserving your precious energy so you can actually enjoy your day rather than just surviving it. They are tools of freedom. It's exactly like putting on a pair of prescription glasses so you can read a book.
Let's look at who actually helps with all of this in Section 4. Move, do, communicate. The rehabilitation professions. So, who's the team that helps fit these keys, prescribes these tools, and teaches us how to use them? Well, let's meet the allied health team. Here is a fantastic cheat sheet to remember the core focus of these three fields, because people mix them up all the time. PT helps you move, OT helps you do, and SLP helps you communicate and swallow. Physical therapists focus on the mechanics of the body, so your gait, balance, strength, recovering from a physical injury, and that requires a doctorate degree. Occupational therapists focus on the doing part of daily life, those ADLs we talked about, fine motor skills and adaptive tools. That's a master's or a doctorate. And speech-language pathologists focus on everything from aphasia and AAC devices to the actual physical, muscular safety of swallowing your food, which requires a master's degree plus a clinical fellowship.
And that leads perfectly into our final section, accessible career pathways. Let's talk about building a career in allied health.
Now I know looking at masters and doctorates can seem super intimidating, but here is the secret. You absolutely do not need an advanced degree to start changing lives tomorrow. You can enter this field at Step 1 as a rehab aide, a home health tech, or a caregiver, which generally just requires on-the-job training. From there, you can climb the ladder to Step 2, becoming a physical therapist assistant or an occupational therapy assistant. Get this, those assistant roles only require a 2-year associate degree, yet they are consistently ranked among the best, highest-demand entry-level medical jobs in the country. And from there, if you choose to, you can bridge right up to Step 3 as a fully licensed therapist.
But honestly, here is the most empowering takeaway of this entire explainer. If you are neurodivergent, if you have an invisible or dynamic disability, or if you've spent years as an unpaid caregiver for a family member, that lived experience is a profound professional superpower. It is not a gap on your resume. You possess an innate empathy and a practical, real-world understanding of difference is not deficit that simply cannot be taught in a textbook. You already know how to presume competence.
By centering dignity, by understanding that aids are tools of freedom, and by presuming the absolute competence of every single person you interact with, you literally have the potential to change lives. Whether that's helping someone get the right AAC device, fitting them for a wheelchair, or just being the best, most respectful aide they have ever had, the allied health field needs you. So, what's your next step going to be? Thank you so much for joining me for this explainer, and I really hope you leave today feeling inspired to go out there and build a career that truly empowers.